Yvonne's on the line in Cheadle. Hi, Yvonne.
Hi.
Now, you're a carer for your son.
Yes.
Okay, and you have concerns over what you've been hearing this morning, I'm told.
Well, I was just wanted to ask Mr. Ellis if he could give me an answer to a logical and reasonable explanation why then very vulnerable disabled persons is having to make an 8% contribution when to care when the Conservatives promised not to take from the poorest and the vulnerable when they appear to be doing this.
What's your experience of it, Yvonne, before we put that to Matthew Ellis?
My experience is that my son attends a day service, and we had a so-called consultation, which wasn't, I felt, in the right perspective. They didn't do it properly, because since then we know that people have been ringing up to ask all the questions, so obviously it wasn't done right. And why the council are allowed to take the DLA care component into account when the Department of Works and Pensions don't do that when they're doing for income support.
Matthew Ellis, how do you sort of square that circle, if you like, of providing things when there are people on disability living allowance, which is what Yvonne was talking about, the DLA component there, and how do you make sure they get the service they need and the service they deserve?
Well, I'm very happy to talk to Yvonne offline if she wants to talk about her case specifically, but I can talk generally. Just first of all, the consultation that was done on the Partnership for Care. A couple of things I'd say. First of all, we have to make the system sustainable for the future. Consistency across the UK. But people can't have localism, local decision making, and then moan or comment on the fact that it's different here to what it is there.
Rolf's got a question about mental health care. Morning, Rolf.
Morning, Stuart. Morning, Matthew.
Morning.
Yeah, it's to do with mental health care in the Haywoods. You talk about the move from sort of hospital-based services to community-based services. But here in the Haywoods, we've just cut the amount of mental health nurses that we have from 7 down to 4. And the people who would normally use that service are now having to go to the hospital to get their services. And these are the most vulnerable people in society. And they are not always in a position to make that journey from their home to the hospital. Now, this is the crux of the issue here, because I think Yvonne, you're a previous caller on this article, she hit the nail right on the head. Because there's a fundamental deceit going on here somewhere along the line. I can't 100% put my finger on it, but what's happening is that money seems to be channeling towards community-based service provision, whether that be a charity base or whether it be an actual private business setting up or a GP commissioning unit setting up a business. And that money is being funneled into that. So that is obviously, there's a logic there that money's got to be taken from the NHS and social care budgets. What that means is that over a period of time, I mean, if you sit in front of a group of people in Cannock or in Stoke and say, look, you're a community-based group and you need support and we're going to support you, they're going to say to the Staffordshire County Council, you're brilliant, thanks very much. But what they don't realise is that money is going to be taken away from the hospital or the social care services that are being provided at the moment.
OK, well let's put that to Matthew Ellis. Rolf, are you taking money out of the NHS and putting it into other areas?
There are some savings that need to be made in the NHS and really across public services.
Well, you've just listened there to me talking to Matthew Ellis on Radio Stoke this morning with regard to the changes that they're making to the social care and the NHS in Staffordshire. It made me really angry. I was only on for a very short period of time and I wanted to say so much, but I couldn't say a lot because, you know, if you've only got literally less than a couple of minutes to chat to him, then he's going to have the whip hand because he can sit there and come out with anything that he wants. Yvonne, who phoned into the programme, phoned in to say how the changes that are going on at the moment, she has a disabled son, has increased the cost of managing her disabled son's illnesses by 10 times. He just didn't answer that. He immediately dodged it by saying, "Oh well, we'll discuss that offline if you want to." He didn't want to discuss it online because that's what's heading for all of us if we're not careful and if we allow this to go ahead. And before I go too much further, let's understand that this isn't just Rolf Pearce ranting and saying, "Oh, he doesn't like this and doesn't like that." I've done a lot of research on this, and Clyde Piddell, who's the co-chair of the consultants at NHS Consultants Association, is also a member of the BMA Council. Martin McKee, who's a professor of public health at the London School of Tropical Medicine, David Struckler, who is a lecturer in social care in Cambridge University, all say that these forms are fundamentally dangerous. Now, Matthew Ellis will tell you, right, that he's only been doing it for 2 years, and he has the temerity now to come and tell us that what we need is what he wants to deliver. After 2 years of looking at it, these healthcare professionals are slamming these proposals left, right, and centre. Yeah, it really is that stark. But Matthew Ellis and the people and the Conservative-led cabinet are going to go ahead. I'll explain to you why this is really dangerous. And dangerous for you. Dangerous for you and your family. At the moment, if you've got an issue, you go to either social care providers, of which there are 9 across the whole of Staffordshire, or the NHS. When you go to those central services via your GP, right, you know exactly where you're going. You know that there's all these different facilities around in the communities, and you know where to go, either Cannock Hospital, Stafford Hospital, and all these things. What Matthew and his colleagues want to do is to channel not just a small amount of funds, but a huge amount of funds to community-based charities, businesses and GP consortia to deliver services that would normally be delivered by the NHS. Now you've got to ask yourself what that really means, and I'll tell you. If I have a cup, and that cup is the NHS, and that cup is full at the moment, and I take a little bit of money and give it to them, a little bit of money, give it to them, a little bit of money, give it to them, a little bit of money, give it to them, and I do that 800 to 1,000 times across all the little groups. When I look into the bottom of the cup, there's not going to be much in there, is there? That cup is the budget for the NHS and social care as we see it today. That cup will slowly but surely become empty. Hospitals will close, wards will close, services will close, and supposedly it'll be these private organisations and charities that will pick up the slack. Tell that to Yvonne, who's had her services and the cost of her services increased 10 times, and Matthew Ellis refused to answer that. Tell that to all the people in the healthcare sector that look after the elderly, who were recently left high and dry by a number of different healthcare providers that went bust and left literally thousands and thousands of old people in care homes not knowing what their future was, and their families. So think very carefully before you move away from the free at the point of service, free when you need it, when you need that expensive hospital treatment or that course of help and support. Think very carefully about taking that away from the NHS and the social care budget that sits in the public sector today, because these community-based charities will be businesses, and they will look at you based on, can they afford to do it for you? And if the funding has been split between one charity and another business and that sort of thing, they may not have the individual funds to fund what you want to do. And like Yvonne, you will be left being told that you've got to pay for it. This is privatisation of the NHS. I urge everybody to complain. This sugar-coated pill, this strategy which will lead to a death by 1,000 tenders of the NHS and the social care that we know today, needs to be scrutinised, and these people need to be held to account. But what frightens me more is that I've not been asked whether I want it, and I know you haven't been asked whether you want it or not, but they're doing it. They are going ahead and they are doing this, despite all the professional people who are against it, people who've lived and breathed the NHS and the health services for the whole of their life, are now looking at these proposals with dread. This is wrong. 2012 and 13 could see the death of the NHS.